So if you're watching this video, you've probably been diagnosed with OP. And I'm sincerely hoping that this is one of the first videos that you watch, because most of the information on the internet is going to tell you that you need to rest for months and months, and that it takes a really long time to get over this injury. And all of that doesn't have to be true if you take the right steps to get better. So first and foremost, you need to ask yourself the question, what the hell does osteitis pubis actually mean? And it's a pretty simple diagnosis from the perspective of osteo means bone, itis means inflammation, and pubis means pubic area. So basically, all that osteitis pubis means when you get that diagnosis is that you have pain in your pubic area. The problem is that some of the most common symptoms of OP aren't related necessarily directly to the pubic area. You can get a lot of discomfort in the adductors. What's really, really common is for people to get dysfunction in their lower core region, moving down towards their hip flexors. Sit bone pain is really, really common, as well as sexual dysfunction and something called a hard flaccid in men, as well as pelvic floor dysfunction and lower back pain. And then there's always the time-honored classic of that really incredible tightness on the side of your hips. All these things are strongly connected to OP, and all of them actually need to be addressed if you want to get over this condition. So the next question that you're going to be thinking about is going, okay, cool, well, how do I fix OP, right? And then you're going to see a lot of things about injections and cortisone and all those kind of things. I would strongly encourage you to not go down that path, at least not right away. Just because what you really need to think about is, how is that fixing my OP? How is that fixing the reason I had my OP? Yes, you have inflammation in your pubic bone, potentially. Yes, a cortisone injection might reduce that inflammation. None of that process explains why you got the inflammation in the first place. So I'd encourage you to keep watching my videos or keep looking for more content that will answer that question, because that's really, really important. Now, the way that I would explain OP is I would say that you have an unstable pelvis. So what I'd ask you to do now is just really think on the symptoms that you're experiencing. So it's probably going to be something along the lines of a really dull ache somewhere in your adductors or your pubic area, maybe some sharp pains when you turn and move. Maybe it's the kind of OP that only comes on when you're running. But my guess is that you will be experiencing something along the lines of tension and tightness through your pelvis. And the way I would explain that happening is that your pelvis is really unstable. When you run, your pelvis needs to rotate like this. When you reach back to lift something, your pelvis needs to rotate this way. When you go to reach down and touch your toes, your pelvis rotates that way. Your pelvis is always having to shift and move relative to what you're doing. So if your pelvis is unstable, well then those rotations, those movements will be unstable. They'll be clumsy. The only problem is that your spine is attached to your pelvis. So if your pelvis is moving clumsily, then your spine is moving clumsily. And if that's happening, well then you are in danger of paralyzing yourself, and your body is not going to have that. So the minute you start to move your pelvis and it becomes unstable, your body will immediately start bracing anything that is attached to your pelvis to try to keep it from being unstable, to try to keep your spine and other structures around there, like your internal organs, safe. So a lot of the symptoms that you'll experience in OP will come from those muscles fatiguing and overworking violently. It's also why it can be so random that you get some of these symptoms. It's why you might get it one run but not the next run. It's because you don't know exactly when those muscles are going to fatigue and tire, and the more you do it, the quicker they will fatigue, but there's not this direct line path that you can really look into, and that's what can make OP so confusing. So what I'd encourage you to do is to really firstly challenge the idea of going, why the hell did I get this condition? And don't go down the path of, well, okay, I have this inflammation, I have this pain, what do I do to get rid of it? Because all the drugs and all the injections and all the surgeries aren't going to change how you move and aren't going to make your pelvis more stable. And then I challenge you to, again, connect to your body and really try to feel what is the experience of the symptoms that you're having. And then what I think you'll find is you'll start being able to go, okay, cool, yeah, it makes sense. I am experiencing, what I'm experiencing kind of feels like fatigue. It kind of feels like this tension and tightening and bracing. And the only difference is that I know what that feels like when I do a bicep curl too many times. I know what that feels like when my legs are really, really tired. I don't really know what it feels like when my pelvis gets really, really tired, because it's an unusual feeling. It's not something you're supposed to feel unless you have OP, unless you have an unstable pelvis. And then the third thing I do is encourage you to keep watching my videos, or keep watching videos like this, because they will educate you, they will put you in a position to understand exactly why you have this condition, and that will allow you to take the correct steps to get better faster. And those people who take years to get better, it's usually because they are going down a path that is not directly addressing the cause of their OP. So they're having to wait for a really long time to inefficiently heal. Whilst if you take the right steps, you can directly address the cause and you can directly heal so you can get back to doing what you love faster.